Health officials in Haiti say they are running out of medical supplies to treat cholera patients. The latest outbreak has killed at least 175 people, but thousands more are suspected to be infected. An economic and political crisis in Haiti has made the situation worse. Among those most affected by cholera are children, like those in our next report.
Lovena Shelov has just lost one of her children to cholera. Now she's fighting to save her 7-month-old daughter, also sick with the same disease.
My son passed away during the night with diarrhea and vomiting, so he's gone. I don't have anything in the house. The neighbors brought me some things.
Haiti has been hit hard by the outbreak. Thousands have been hospitalized, and a lack of resources means not everyone can survive this treatable illness.
The government does not have enough IV because it was not prepared to treat so many people. They all have diarrhea and need hydration solutions. They need beds.
Violence, crushing poverty, and street blockades by armed gang members are also preventing access to safe water and health clinics. The situation has prompted the UN to launch an appeal for nearly $150 million. But it is not only the Caribbean island nation that has been affected. In 2021 and this year, several countries in Africa and Asia were hit by cholera outbreaks. An epidemic in Syria that started in August has led to infections spiking in neighboring countries, including Lebanon. In October, poverty-stricken Lebanon reported its first case in 30 years. The rising number of cases pushed the country to launch a cholera immunization drive. But the World Health Organization has warned of a worldwide shortage of cholera vaccine, leaving thousands at risk of losing their lives unless help comes soon.
Let's bring in Jennifer Higgins here for more. She's with the International Rescue Committee, and her work focuses on Syria. Thanks for being with us. Ms. Higgins, cholera is spreading in different parts of the globe, including the Middle East. How serious is the situation in Syria?
Thank you very much for having me here today. And I think it is really vital that we're discussing this topic of the growing global crisis of cholera. This cholera outbreak, especially in Syria, is really just an additional layer on what is already an acute and protracted crisis. It's the first cholera outbreak that we're seeing in Syria in over a decade, with the last one reported in 2009. And until the 17th of November, we've now had a recorded 35,000 suspected cases with 92 deaths, with specifically the northeast of Syria being the most affected. And it's very difficult also to really be sure that we're getting a clear estimation of really what the numbers are, especially in areas like northwest Syria, where it's just very hard to gauge the numbers because of the varying responses and level in the provision of healthcare. We've also now, as you've reported in your piece just now, had cases confirmed in Lebanon and several also in Iraq, showing how this is really just a much bigger issue, more regionally as well as globally. And especially in rural areas of Syria, what's kind of been at the heart of this specific and current crisis is that the piped water supply really isn't meeting the basic needs of the population, and many are left looking for alternative sources of water. And this is because of, after a decade of conflict, as you can imagine, there's been a real breakdown in both the scarcity of water, but also the infrastructure that provides water. And this pushes many communities to have to resort to find other places.
I wanted to ask you about vaccines, because the WHO, as you know, is warning that there's soon going to be a global shortage of cholera vaccines. Is that likely to affect Syria and the surrounding countries you've mentioned?
Yes, indeed. The WHO has warned, and there is currently a limited global supply of the oral cholera vaccine, and this is due to the multiple ongoing crisis. And because we have this bigger global issue, it does mean that there is a severe limitation on the number of doses and supplies that can be available to Syria. And this is combined with severe funding gaps for the health sector, as well as limited existing medicines and also human resources and healthcare provision for people to be able to respond to an outbreak such as this.
So vaccines are in short supply for treating cholera. What else can be done to contain a cholera outbreak and treat people who are infected?
Yes, really at the heart of cholera prevention is really treating the source. And in this case, we have identified that the source of the current outbreak was originally the Euphrates River, but this is obviously spread now because of migration of people, etc., and because of the limited healthcare infrastructure. So we at the International Rescue Committee have really been working to identify source and then also working on prevention and also protection. So it's really important, and we have been working to train clinical staff and also community healthcare workers on case management, on detection, and also on providing the medicines available to be able to treat the cases such as oral rehydration therapy or zinc tablets, and doing really house-to-house community level based intervention.
Jennifer, thank you for that. That was Jennifer Higgins from the International Rescue Committee.
Thank you very much for having me.